Hello there. If you've not tuned in to my videos before, my name is Stacey Sanderson, and I am an author and psychotherapist in Ontario, Canada. And here is where I come in to do what I've called fireside chats. But what I really want to do is offer up some accessible, meaningful content about narcissistic personality disorder, narcissism, relationships, all about being an empath or a highly sensitive person. And I'm also going to come in and offer additional content about personality disorders and other forms of mental health challenges. Essentially, what you will hear me do is to share some ideas that come out of the work I do in both research, writing, and with clients. So, whatever I feel might be helpful, I will do my best to share here in this space. And this morning, I had the pleasure of doing a consultation with a colleague. And I'm not going to share the details of that, obviously, but it did inspire me to talk a little bit about the differences between narcissistic and borderline personality presentation in men. So, anecdotally, where much of what we read and understand about N.P.D is often about men, and conversely, what we read or learn about B.P.D, borderline personality disorder, is about women. And certainly, as therapists, that is somewhat of our grounding of understanding the topic. But over the years, I have had the occasion of meeting men with borderline personality disorder. And it looks, and if you're intuitive, it feels different. I want to begin by saying that I believe that B.P.D is one of the most severe mental health challenges someone can experience. It is rooted for sure in childhood attachment issues or even childhood trauma, complex relational trauma. I'm going to do a bit of an overview of how this presents in men. And so this will overlap a little bit with the technical diagnostic criteria, although I'm going to try and share more of what it actually may look like. First and foremost, I think borderline personality disorder is more obvious in the context of a relationship. Rather like narcissistic personality disorder is, you may not see the signs or the traits in someone in a more boundaried relationship. So again, I will be talking about some of the similarities and differences between the two, because I think that they're often confused. And if you're in a relationship with someone with either character disorder, it can be very confusing. And I did a talk on Friday night, and one of the things that came out as we were talking about mental illness is the relevance of diagnosis or the relevance of labels. And I think that if you're in relationship with someone, being able to understand them through the concept or through the information that comes along about personality disorders, because that's what we're talking about here. But I think that that is very valuable, really, particularly if you started to doubt yourself and your own reality, as is what so often happens in these relationships. So, borderline personality disorder, again, is rooted in complex childhood trauma that, much like N.P.D, influences the development of self. Now, where in narcissism, like pathological narcissism, there is an overdevelopment of the ego part that protects the psyche of the narcissist, and so they are really very much living in this false version of themselves, or even a delusion about themselves in the world. For men, in this case, with B.P.D, this is a fragmented sense of self, and they live very much in a wounded sense of self. And there is a real fragility around their identity. So with narcissists, there's a fragility around feeling vulnerable, experiencing shame. I've been doing a lot of research about narcissism and shame and self-esteem. So for the narcissist, their sense of self and their self-esteem is protected by these grandiose beliefs about themselves. With borderline personality, they lack a coherent sense of self, right? It isn't even that they develop, this mask, if you will, as we often refer to narcissism. They are also very much more emotionally dysregulated than narcissists are. So B.P.D is characterized by a lack of core identity, or a real fragmentation of identity, as well as profound suffering rooted in emotional dysregulation. I think that people with B.P.D, and this is true for both men and women, but there's always this hypervigilance around, am I safe? With narcissists, their hypervigilance is around, does this person think I'm special, or do I feel special? In B.P.D, it is very much more, am I okay? And so they vacillate with respect to how they feel about people quite regularly. Like it is an inner constant struggle. They genuinely have great difficulty with boundaries. They move in too close too fast. Like if you're dating someone who may have some of these signs, there's a mirroring that can happen, slightly different than narcissism. They attach very, very quickly and can just as quickly withdraw out of the relationship. What goes along with all of the things I've said is an instability of the way they see themselves and the world. And so they can be very much easily activated by things like tone of voice, eye contact, perceived slights. I believe that there are some deficits in perception and communication. So when I was teaching counseling, I would explain that if you have someone with a personality disorder that you're working with, you know what you're saying, but they hear something completely different. So having worked with a handful of people who have B.P.D, as a therapist, I'm very careful to keep notes with direct quotes of things I've said. But they definitely, there's a deficit around that communication and perception because of how hypervigilant they are being, or how much they have their backs up about what you're saying. And it is all guarding against rejection and perceived rejection. So coming back to this idea of the hypervigilance, there is a core wound of abandonment that they carry with them. Some of this may even be pre-verbal. And so what occupies a lot of their consciousness is that safety with someone, that relational safety of, is this person going to stay with me, or are they going to abandon me? Which in men shows up in a much more aggressive way. In women, it's more internalizing. In men, it is more externalizing. So they can be easily suspicious. They are more prone to infidelity because they have another relationship that they're pursuing as a way to feel secure. I forgot to continue going on about boundaries, but it all connects. So people with B.P.D don't have a solid understanding of the boundary that is being requested by another person. And so they either don't get it or they perceive it as a rejection. That's where I was going with all of that. And they will want to know things about you a little bit too quickly. They may investigate a little bit more about you and your history than someone else might. I think that they can become quite obsessive about someone they're dating or in a relationship with. They're deeply, deeply untrusting, probably a projection of what they're doing, a projection towards you based on what they're doing. They not quite often, B.P.D is concurrent with a substance use disorder. And this would be quite an extreme substance use disorder. And this could be alcohol, this could be street drugs, this could be prescription drugs, this could be cannabis, this could be all of it. What goes along with this is they can be somewhat secretive in what they're doing as well. Men with B.P.D are not as charming as those with N.P.D. They're a little less concerned about what you think of them and a little bit more concerned with, will you stay with them? Okay. Or will you abandon them? There is a tendency in younger years toward self-harm, which in later years can manifest as an impulsivity, recklessness, gambling, making poor decisions. There are some overlaps in presentation with bipolar illness, and you can have both at the same time. I'm just making sure I'm not missing anything on the list. Your relationship with them will be very, very fragile. You may think everything is okay, but it isn't. There can be elements here of being controlling, being abusive, all of this tied to that difficulty with inner regulation. So again, that is correlates, right, with what people experience who are highly narcissistic. But I believe this fundamental difference is the core fear. Narcissist, again, is about not feeling special. With B.P.D, it's a fear of abandonment. I'm just recollecting the times I've worked with men with B.P.D. They are very caught up in their victim story. They very much have a victim, archetype that they're operating from. They will struggle a little bit with possessiveness, and they lack insight. I believe that those who have B.P.D do have empathy, which is a bit different than N.P.D, right? Not having empathy, of course, is a core feature of narcissistic personality disorder. Many women I have met with B.P.D are whom I refer to as dark empaths. Do with that what you will, but it is not lost on me that they are deeply, deeply empathic, but they tend to filter out the good and focus in on any negative energy that they can find, right? It's like having an ongoing confirmation bias that people are bad. So then they go looking for that. But most people I have met with BPD, male and female, have a deep reverence for nature. They love animals. They have a heightened sense of justice. So you can hear where the parallels are with empaths, but their wounds keep them from really stepping into the best parts of that empathy that they have great capacity for. I think because they suffer so much, they can recognize that suffering in others. Men with BPD will create what I'm going to unprofessionally call a pity party with you. So you're suffering, he's suffering, let's all suffer together. And the relationship can very much become anchored in this shared suffering or focus on being unwell. They have great difficulty having therapeutic alliance. So that's not an easy way for them to get help. Although I think that there are other modalities that can be helpful, such as mindfulness. So anything that, or even yoga, somatically or trauma-informed yoga, something like that can be very helpful for them to learn those self-regulation skills. BPD in men is mischaracterized, overlooked, misdiagnosed. Of course, many people with personality disorders also have depression, but there's if the BPD is overlooked, the treatment geared toward depression alone will not be sufficient. So it gets misdiagnosed as narcissism, bipolar illness, sometimes ADHD. But like all personality disorders, there needs to be the presence of at least 5 symptoms, if you can use that word, or traits. I don't think symptoms is an accurate word. It does need to be chronic over time, and there does need to be a level of impairment that's happening in their lives, whether that's vocational impairment, relational impairment, even issues with substance use would factor into this. These tend to be men who have difficulty holding down a job. They have an increased risk of criminal activity or running into difficulty with the law. I know a long, long time ago when I worked in corrections, there were a number of men who were formally diagnosed with borderline personality disorder. So this recklessness, this impulsivity that I'm describing very much puts them at risk for doing something illegal. There is a heightened chronic suicidality, and they are very prone to making idle threats. Again, everyone has to do their due diligence. If you have someone in your life that is threatening to harm or kill themselves, but often it isn't so much that they want to die, but that they just don't want to feel this way anymore. And I am not belittling that, and I would still take those threats very seriously. I've known some people with N.P.D to also make those threats, but the the for people with N.P.D, I think it is a bit more dramatic and manipulative, and not felt as genuinely as it is by someone with B.P.D. So they're not mutually exclusive disorders, and some make the argument that borderline exists on the spectrum of narcissism. I'm not sure where I land on that idea. I actually see BPD as being much more severe for the person who's experiencing it than NPD. But these are men who have not fully self-actualized, fully individualized into their adult selves, into their authentic themselves into a healthy psyche and identity. And for this reason, they are difficult to be in relationship with. So if you have any questions about that, please feel free to note so in the comments. Feel free to DM me. Like, subscribe, share if this has been helpful. I would like to know that. So I wish you a very good rest of your day or evening. Take care.